Hi, my name is Dr. Ed Beyer. I am a chiropractic physician. I've been practicing here in Tinley Park for 22 years, and I would like to welcome you to our website. Our clinic specializes in treating chronic diseases, chronic neck pain, back pain, if you're suffering from migraine headaches, fibromyalgia, vertigo or balance disorders, restless leg syndrome, insomnia, irritable bowel syndrome, thyroid problems, chronic fatigue. The list could go on and on, but that's what we specialize in. And what I want to do is spend a few minutes on this video explaining what makes our treatments different from what you've heard so far. Many of the patients that come to our office have been complaining of lack of energy. They're on several different types of medications. Their medical doctor doesn't seem to have any solutions. They've been going from doctor to doctor trying different medication after medication. They've tried different traditional chiropractic care or physical therapy and all sorts of different things, acupuncture, and they're still suffering. So our office specializes in these chronic diseases, and I want to explain to you what makes us a little bit different, actually a lot different from anywhere else. First of all, in our clinic we have a three-prong attack toward these chronic problems. First, we treat it structurally. What I mean by that is traditional chiropractic that you would receive in a lot of different offices along with physical therapy. But also, most of these chronic problems have a neurological basis. The brain simply and the nervous system simply are not functioning at 100%. And the third prong in our attack toward these problems is that we treat you metabolically. What I mean by that, metabolism simply is taking things into our body, and such as food and water and the things we drink, and changing it into energy. So we look at the metabolic portion, like looking at your thyroid gland, the function of your adrenal glands, looking at the gut as a source of many of these problems. On the structural side of things, what makes us unique is that for neck and back problems, usually there is some sort of degenerative disc or herniated bulging disc involved. We do what's known as spinal decompression therapy, and then we combine that with physical therapy and chiropractic adjustments to get people better. That was the only way that I practiced, and it is the only way that most chiropractors practice until about 4 years ago, when I started studying what's known as functional neurology. And what I mean by that is most of these chronic problems have the nervous system is not functioning properly. Now, what I mean is that certain areas of the brain could be have slowed down, causing other areas of the brain to speed up. And we know that we can detect these lesions in the brain not by MRIs or CT scans or imaging. Those type of imaging procedures show what's called a hard lesion, like an aneurysm or a cyst or a tumor. We look for functional lesions in the brain by doing specific functional neurological tests, and we find the areas of the brain that are not firing properly, and we correct them. Now, how is this possible? Well, we know that the brain is just like a muscle. If a muscle is weak and atrophied through disuse, or perhaps you had a cast on your arm from a broken bone, the muscle will become weak. And you can strengthen the muscle through proper exercise and through proper fuel. The brain is the same way. We used to think that decades ago, the scientific thought was that the brain, once the age of 3 once we're 3 years old and above, our brain never changes. But that's absolutely not true. There's a concept called neuroplasticity. The brain is constantly changing dependent upon the stimulus that we give it. So we know that if we find weak areas of the brain, we can make them stronger by doing neurological exercises and strengthening those areas of the brain. And then we fuel the brain. Now, what type of fuel does the brain need? It needs proper oxygen, and it needs glucose, good glucose. So we need to make sure that when patients come in with these chronic disorders, such as what I mentioned earlier, that their blood glucose levels are between 80 and 100. Very, very important for neurological functioning. So we were able to find these areas of the brain that are weak and strengthen them through neurological exercises and proper fuel with oxygen and glucose. Now, we know that most problems such as like ADD, ADHD, fibromyalgia, chronic fatigue syndrome, chronic back and neck pain, lumbar stenosis, sciatica, migraine headaches, insomnia, irritable bowel syndrome, all not only have a neurological component to them, but they have a metabolic component to them. And what I mean by that is certain things in your body, certain glands, and certain parts of your endocrine system are not functioning right. There's a lot of talk in the body between the endocrine system and the brain. So if the endocrine system isn't working right, and if our immune systems aren't working right, then our brain will not work right. And this is the cause of a lot of these disorders that I've already mentioned. So we look at you very extensively metabolically. This is very important, that we look at all the pieces of the puzzle, that we leave no stone unturned to find out what your cause is. Many doctors have an oversimplistic approach toward these chronic diseases, and it's the reason why you haven't gotten better and you're extremely frustrated. Here you're going to find answers to your problems. Now, metabolically, very common areas are most people have some sort of blood sugar imbalance, where either their blood sugar is too high, they're insulin resistant, or their blood sugar is too low. This will stress another part of the system called the adrenal glands. The adrenal glands are your stress glands. So there are certain hormones secreted by your adrenal glands that, if they're too high or too low, will make your body not work right. Often the problem is in the gut. Even the father of medicine, Hippocrates, said that 90% of medical problems, illnesses, originate in the gut. What we're finding is that most of our patients with chronic problems have some sort of food sensitivity, where they are eating things that are literally causing their immune system to overreact to what they're eating. Once your immune system is overreacting or attacking certain things that it shouldn't be attacking, you're going to have inflammation throughout your body. And I'm here to tell you that just taking pills or just getting a massage or a chiropractic adjustment or physical therapy isn't the solution to that. You have an internal metabolic thing going wrong. So we check the gut, we check the adrenal glands, we check your thyroid glands, we look at you to see if you're anemic. You cannot live very long without water, you cannot live very long without food, but you really can't live very long without oxygen. If you don't have enough red blood cells or iron in your body to carry oxygen throughout to all your tissues, your body is not going to heal, no matter what form of therapy you're receiving. So we need to look at you structurally, we need to look at you neurologically and metabolically. The metabolic and the neurologic are tightly tied together. So, for example, in your body you have receptors on every cell in your body for thyroid hormone. If your thyroid gland is not working properly, you're anywhere in your body can have a problem if it's not receiving enough thyroid gland hormone. Now, the other thing is that a lot of times people come in and I'll ask them about their labs and what they've had done, and they say, well, my doctor says I'm fine, my lab values are normal. What you need to understand, this is a very important concept if you've been told that, is that lab values, the ranges that labs use are very, very wide. What a lab will typically do is they'll take the average of who came into that lab and over the last year, and those will be the ranges. Well, I'm asking you, what type of people go to labs? Sick people or healthy people? They're sick people. So lab values and lab ranges that your doctor looks at and goes by are very wide. We use functional ranges, okay? We know that if you're not within a certain functional range, your body will not work right. So those are the ranges that we look at. And once we find a problem, in most cases we're able to nutritionally support this area with proper compounds of glandular, herbal, vitamin cofactors and minerals to support whatever gland is not working right and get it back to normal and allow your body to function like at optimal levels. So I welcome you to the website. What you're going to hear here is very different. What you have is a very complex problem. There's no simple solution to it, but we have all the answers. We don't stop until we know all the information and how to treat you properly. So we also have workshops weekly in our office on different conditions. So we rotate them. So come back to the website and see what we're doing each week. The workshops are very informative, or you can order DVDs and to get more information. So again, if you're tired of what you have and you're frustrated, I understand that, but what you're going to hear here, what you're going to see here, and how you're going to be treated is different than anywhere else.